Okay, joining me here today on the Psychedelic Spotlight podcast is Brett Waters, who is the co-founder and executive director of Reason for Hope, a national nonprofit organization focused on the policy and legal reform necessary to advance safe, ethical, and affordable access to psychedelic-assisted therapy. Brett, thank you so much for taking time to join us. How are you doing today?
Thanks, Damien. I'm doing well. I appreciate you having me on. And how are you?
I'm doing well, doing well. It's a busy time of year, a lot going on. Of course, still kind of decompressing from the psychedelic science conference there in Denver a couple of weeks ago, which was quite the event. Did you have an opportunity to attend?
I spoke on a panel. I think I was maybe the first panel right after the opening uh, with Rick Doblin. I spoke on a panel on federal and state policy, and I was think I made it to one other panel. Dr. Averill, our co-founder of Reason for Hope, outside of mine, and unfortunately, I was only there for 2 days, and it felt like needed 2 weeks. It was definitely a whirlwind.
It really was. It was impressive. The turnout, I heard somewhere in the ballpark of 14,000 people showing up to the event. But like you said, it was just stacked with multiple speakers and different types of exhibits and things. It was really impressive to see the space coming together like that. Unfortunately, I had to leave as well early due to a personal matter, so I didn't get to take in everything I wanted to. But wonderful event, and certainly a sign of where the space is going right now. So that was certainly exciting. I want to talk today a little bit about the work you're involved in here with Reason for Hope. So if you wouldn't mind, Brett, just giving us a quick overview of the organization that is Reason for Hope.
Sure. So I started Reason for Hope a few years ago now, while I was still an associate attorney at Winston and Strawn in New York City. I started it as a nonprofit policy and advocacy organization, just as a pro bono, like volunteer project, essentially. After spending some time doing policy work with the American Foundation for Suicide Prevention, New York City chapter, and unfortunately, I came to the space and or suicide prevention policy and advocacy work more generally after losing my mom, Sherry Hope Waters, who the organization is named after. I lost her to suicide during my first year of practice, and that's how I got involved generally in this work. I'd lost my grandfather, her father, to suicide when I was young, and kind of during that time, I came across the research specific to psychedelic medicine, and it really clicked with some of my own prior experience, and so that's what led to starting the organization, which I co-founded with Dr. Lynette Averill, who also lost her father, was a Marine, to suicide, and retired three-star general Marty Steele, former chief operating officer of the Marine Corps. And so we started this kind of small policy organization just as a volunteer project, and it has, rapidly grown. Since then, I've, left my job towards the end of last year at the law firm to focus on this full time. And as part of our work with Reason for Hope, we ended up spinning off a separate organization called the Veteran Mental Health Leadership Coalition, which is a membership organization with a number of the leaders of veteran service organizations who've been taking people outside the country, as well as researchers and healthcare providers, attorneys, other mental health experts working in the veteran space, and have put together this big coalition with a number of non-veteran partner organizations as well, ranging from organizations like Cluster Busters to people from the 9/11 survivor community, and it's an organization of primarily nonprofit, like patient advocacy and veteran service type organizations, and we have been active on the policy front at the federal and state level over the last year, and happy to get into some more of the specific initiatives, but it's been a really unbelievable experience to just work with such an amazing group of people who are unified in the cause, and have a lot of people with their own personal experiences of whether of loss or of healing, and working to improve the mental health system. And I'm just honored to work with so many amazing individuals.
Yeah, so let's talk a little bit about some of the initiatives, and the progress that's being made out there. It seems like there is some encouraging progress being made, particularly at the state level right now. Of course, we all know what happened, with Colorado, as they followed in the footsteps of Oregon, and setting up a program for access to psilocybin therapy. Also in the news recently, Kentucky announced that they're allocating $42 million for psychedelic research. Want to talk, get your perspective on some of this progress that's been made here, and just, a high level overview based on, being someone that's so involved in a lot of this. How encouraged are you by it? And, do you anticipate, seeing more on a national level here in the United States in the coming months or years? However you can speak to that.
Sure. So, particularly after the House flipped this past year, we've really kind of followed a strategy of federal regulatory reform. We saw an opportunity to maybe achieve federal deregulation with the House under Republican control, while going after the funding, which we knew would be a little bit more difficult in that circumstance at the state level. We think that that's been pretty effective this year. We're right now at the federal level, I've been working on the Breakthrough Therapies Act, which would reschedule any the active ingredients of drugs that get a breakthrough therapy designation or that the FDA approves for expanded access. Would essentially automatically require them to be rescheduled from Schedule 1 to Schedule 2, which would reduce the barriers to research. It would open up access under the Right to Try Act, and reduce the barriers under the FDA's expanded access program. We're basically just utilizing the same process that already exists after FDA approval, this 90-day window to reschedule. Same timeline, same process would exist for this, what I consider potentially like an interim rescheduling in advance of full FDA approval. After FDA approval, just as it is right now, get reviewed again, and hopefully, get moved to a lower schedule. But this is something that we felt was, achievable, and is making good progress with, bipartisan support in the House and the Senate. It's been submitted as an amendment to the National Defense Authorization Act, and we've certainly been making a lot of progress there. And then at the state level, we have been working primarily on funding initiatives like Kentucky, where we recently participated in a press conference announcing that proposed $42 million for ibogaine research and development. That is, hopefully if that vote succeeds in November, there will be an RFP opened up that will go towards, anybody be able to submit bids to be able to get that funding to advance ibogaine through the FDA. Unfortunately, $42 million is not enough to get through the FDA process, and so we are working very closely with the Kentucky Commission and with other states, starting the process to try to get a larger consortium of state funding with others to match that. While $42 million might not be enough, $420 million certainly would get us pretty close. And so we are going to be pursuing that, pretty strongly over the next year. And, the other focus at the state level for us recently has been on the research and implementation of the breakthrough therapies. So for MDMA and psilocybin, we've been successful getting funding for these, state programs that will, go towards hopefully more bridging the gap between the, clinical research and clinical implementation of these substances and accelerate the timeline for patients to actually get access, starting through either investigator-initiated trials or FDA expanded access programs, and then into more formalized patient access programs that will, in order to get the funding, require certain data collection and, monitoring, so we can continue to improve our practices, hopefully expand insurance coverage, and make sure that this is actually working for people, ideally in the long run. And so I think this is, kind of something that we feel is just a generally needed mental health reform, not necessarily specific to psychedelics, beyond the fact that this is a new field, a new market essentially that's coming in. It's like instead of repeating the mistakes of the SSRI era, we could really do this better, I think, from the beginning, if we are tracking how this goes for people in the real world. Because I think, there's a lot of frustration from patients. I count myself amongst them, who have used SSRIs and have used them for many years, and that's really not the way that they were studied. It's not the the endpoints that were studied that help these drugs get approved, and then they're studied at, like, say, 8 week endpoint, and then people are prescribed them for 6 years or 20 years, and we don't really have a lot of good outcome data on what the effects are for people who are on it for that length of time. And I think this is really an opportunity with the beginning of this rollout of MDMA and psilocybin to do it better. Like, how is this working for patients that are not that are real world patients, not just the ones that are more carefully screened and selected for a very particular indication, like just PTSD or just depression, but people who have comorbid PTSD and depression and alcohol use and potentially suicidal ideation. And these are the people who are going to be seeking treatment in the real world. And so being able to track what that looks like and get better understanding of the long-term outcomes, how frequently people might be seeking to reuse treatment, the number of people who are seeking to utilize both MDMA and psilocybin moving forward, because I'm certain that that is going to be happening. And getting a better understanding of this in the real world, I think, will be really valuable towards improving mental health care generally moving forward.
In talking about understanding that in the real world, we saw Australia recently approved MDMA and psilocybin as a treatment for PTSD and depression, really becoming the first country to do so. So I'm curious, how much does that and what's going on in Australia play a role in any of your work? Does it affect it in any way? Is it something that you can point to and say, this is an example of why this is something we are working towards here? I'm just curious, because it really does seem like they're kind of leading the way there in terms of utilizing MDMA and psilocybin for the treatment of PTSD and depression.
So it's certainly it wasn't what I guess causes us, because we'd already started on this before that happened. But
of course,
it is absolutely a very similar idea. I mean, there are slight differences in the legal systems in the United States and Australia. So even if this were, rescheduled, for example, Schedule 2, which doesn't change any criminal penalties, but it does, reduce those barriers to research and allow access under the Right to Try Act. These drugs would be eligible, what's called eligible investigational drugs under the Right to Try Act, which applies to anything else that isn't in Schedule 1. And so all we're trying to do is make it so these are on par with everything else, and keep it to be a science-based decision based on what the FDA has already determined, which has already determined that these are breakthrough therapies, already approved MDMA for expanded access. We believe that should trigger a rescheduling, and we filed an amicus brief for Reason for Hope and the Veteran Mental Health Leadership Coalition, arguing that these are promising suicide prevention treatments for a number of reasons. Like, they should be immediately rescheduled to help us kind of phase the rollout of this for those, starting with those who need it most. And, then when full FDA approval comes, we'll have more providers who are actually prepared and trained to properly deliver treatments. So we think it is, absolutely the right thing from a policy perspective to be doing. And we, certainly applaud Australia for taking that initial, step. And I think that there are definitely similarities between that rescheduling and maybe what like a broader expanded access program could look like in the United States, where there are specific controls over the, prescribing rights and like required training and protocols. But I look forward to tracking how that rollout goes in Australia, and I'm confident that it will demonstrate to people that this is something that we can be doing here and we should be doing here.
Exactly.
It's the right thing to do.
Yeah, and I'm curious, how, based on, your professional line of work and also maybe even your personal life, I mean, how has the conversation surrounding psychedelics and psychedelic substances changed? I mean, obviously these have been substances that have been demonized in many ways. There's been a stigma tied to them for decades, going back to Richard Nixon's war on drugs. I grew up in the 80s, so I was a part of the DARE program growing up, where I was taught that all drugs were bad. Psilocybin was just as bad as crack cocaine, which was just as bad as heroin and just as bad as marijuana. So trying to shift that conversation around some of these drugs, I think, has been challenging. As someone that's involved in so many conversations and that is actively on the front lines trying to shift that conversation, how have you noticed changes out there? And is the pushback starting to dissipate at all? Are people starting to finally understand and maybe be a little more receptive to the idea of psychedelics actually having a true therapeutic benefit associated with them?
Absolutely. Definitely a shift. I'll say that for me, kind of going back to like how I kind of got into this space initially. So I was born in 1988. I had been through the DARE era.
Mm-hmm.
I certainly feel like I was the victim into it in a certain extent of like horrible misinformation about drugs generally for my whole life. And I had an experience in college with psilocybin mushrooms, just recreationally, that essentially healed. I struggle to use the word healed even, but it basically treated, healed an eating disorder that I've had my whole life. It's called an avoidant restrictive food intake disorder. It's like a severe phobia of foods, a very basic childhood foods my entire life, and preferred hiding behind the fact that I was a wrestler and always cutting weight, and preferred people thinking I was anorexic to like what I was actually dealing with. And this, experience with psilocybin basically just like reduced my anxiety about trying new foods for, a 6-month window where I was able to just kind of eat normal adult foods. And it's not that I liked everything, but I liked enough that it changed the course of my life. And, that's really stuck with me moving forward. Eventually the effects wore off. I'm not today as bad as I ever was before that experience, but, certainly the anxiety, still exists for me. And I always get asked like, well, have you done it since then? Like, why not? And I had this experience, and my parents, like, I certainly told about it, and my sister and my close friends who knew I had this issue and were there and saw the change, like they all knew what happened. But most people, I never talked about this for many years. I had just chalked it up to a miracle. And then I just, I think because of that kind of drug war, like misinformation, I just was afraid of like, oh, I'm going to go crazy. I'm going to get a hole in my head, whatever nonsense is out there. And I, really never looked into it. And then after I lost my mom and eventually came back across all this research in the space, like that was an incredibly triggering thing for me. I mean, I have like an immense amount of guilt about that. Yeah, I mean, I carry a lot of weight, and it definitely drives a lot of the work for me, is
Yeah.
that like I know that there are just so many other people out there who have this misinformed belief about the risks, are maybe unaware entirely of the benefits, uh, and the policy and like the legal barriers getting in the way of progress here are just so immense that I mean, there's all of this was kind of what drove me to like really go all in, and put in, while I was working at the firm, like, I mean, I was just basically not sleeping. I was just I was putting into crazy big law hours and then doing this pro bono on the side. And then it got to a point where I just could no longer do both, and have left. And I'll say, I don't think the hours have necessarily gotten much better, but the work is obviously very meaningful. And we are optimistic that we're making some good progress here. But yeah, I mean, correcting, I think that misinformation and stigma is so important. And I do think we're making so much progress on that front. Like, there are not a whole lot of people who we come across when we go into a meeting with, particularly like when it's, our whole leadership team, that we have a retired 3-star general who has been, lost so many people and has been at the forefront of mental health reform and reform at the VA for so many years. A researcher and clinical research psychologist who works in the VA and is a professor at Baylor, lost her father to suicide. Lost my mom and my grandfather to suicide. There are not a whole lot of people who are going to, kind of hear the legal and the scientific and all of the kind of information that we're presenting, and the stories and all of the veterans who have gone through these treatment, whether in the United States through clinical trials or outside the country. A lot of them, a lot of people we work with have gone through the Mission Within program in Mexico, or using ibogaine and 5-MeO DMT, or have gone through Heroic Hearts Project and used ayahuasca. There's a lot of people have gone through programs using psilocybin, MDMA. I mean, there's a mix of everything. And so you hear these stories, and there's just no way at this point that you can just balk at it and chalk it up to like not real. Just the mix of patient testimonials and science that are driving this forward, I think, are both like critical pieces of the puzzle to really changing the narrative and expanding, not just changing the law, but like getting people comfortable with the potential and actually wanting to utilize these substances as potential healing opportunities. And it certainly isn't for going to be for everyone, and I think that there are certainly people who are going to be higher risk, and it might we might need a lot more research before it would be appropriate for them to try it. Certainly would need to be in the right environment, and yeah, we definitely have a lot more to learn. But I think that generally speaking, like, we're just come such a long way, even in the like couple of years I've been involved in and the narrative for me, just I guess because I wasn't coming from cannabis advocacy necessarily, or like I have been involved in like psychedelic universe for as long, so it's, for me, it just feels like a no-brainer that like everybody should be supportive of this, at least to some extent. And we're I mean, I think experiencing some of that, like the conversations are usually receptive, positive, and definitely, definitely making progress.
Absolutely. And I think a lot, what I found is that a lot of individuals, myself included, that are involved in the space and that are pushing for advocacy here, we have a personal tie to this space. It's whether it's ourselves individually or family members. Myself, I've shared the story about losing my father in 2018 after his long battle with alcoholism and depression. And similar to the story with your mom, it was shortly after the passing of my father that I started to come across stories and research and information surrounding psychedelics, and came across one particular story which was very similar to that of my father's, where it was a woman that was suffered for years from alcoholism and nearly took her life. And she was fortunate enough to discover psilocybin therapy through a retreat, and it completely transformed her life. And it got me thinking, why are we not talking about this more? Why is this something still being kept in the shadows? And so I find that there's a lot of individuals here in this space that are so passionate about the work that they're doing here for personal reasons, because unfortunately we've experienced so much loss and despair and pain. And I'm wondering, from your perspective too, and the people that you've spoken with, do you find that most people here that are pushing for advocacy here are doing it for very personal reasons?
Yeah, I do feel like there are a lot of people, who come to this space. I mean, naturally, just based on
Yeah,
whether experience of loss, healing. Yeah, I think there are certainly some who have no experience at all, like including General Steele and Dr. Averill, who aren't personally using, but like have seen what it has done for other people, and have been involved with different research, and are highly credible people, but still have those personal stories. And for me, like, even like there are just some days where I just want to go in and be like an attorney and then explain the legal barriers and explain the policy considerations, and not talk about my personal story, because really can be exhausting. And I think everybody experiences that to some degree, because it is I mean, very personal for most people who are involved in this. And I do think it's an important part of the story, and can those particularly powerful stories of healing too, like, are just so vital to moving the needle forward. And the number of people who are getting involved in this just continues to grow, and has been I think a critical component to helping to move this forward.
I do. Yeah, I agree. I think the people being brave enough to share their personal stories and experiences, I think that's what's helped move the needle here more than anything else. Especially when you have, whether it's retired sports athletes like Riley Cote, who we were at the screening of his documentary a couple of months ago, or I mean, you've got actors, musicians coming out. I think that's helping to normalize the conversation surrounding psychedelics right now, which is important. But Brett, one last thing that I want to touch on here before we wrap things up is accessibility and affordability, and getting your take on understanding the difference between the two. Because yes, accessibility is great if we could have a legal landscape where psychedelics are readily available, whether it's through clinics or what have you. That's fantastic, but that's still there's still a barrier of affordability there. And I'm just wondering, from your perspective, how do you see this playing out? Can affordability keep up with accessibility as things start to progress here in this space? Or do you think that affordability is going to remain a barrier for individuals, particularly, we're talking about, marginalized communities? Just curious to kind of get your thoughts on the difference between accessibility and affordability as this space here of psychedelics continues to evolve and progress.
Well, yeah, I mean, we have a very long way to go, to say the least. And I think there's a number of ways that access and affordability are probably going to move forward. And one critical component to that is at least in the terms of like psychedelic assisted therapy, and using this with under the care of like a professional is we're going to certainly need to, have like robust insurance coverage, and Medicaid in particular is, Medicaid coverage is going to be critical. We're going to need to have far more people who are actually trained to provide this, particularly like frontline healthcare workers, like nurses and social workers. We're going to need to broaden who can prescribe this. We already have a very broken mental health care system with limited accessibility to psychiatrists. We're going to need broader prescribing privileges, and there are some states that already have that. Whether it's psychologists or psychiatric nurse practitioners, and I think we're going to really need to broaden the number of people who are going to be able to prescribe under the medical system, and certainly decriminalization and religious use are other, I think, systems that can that will move forward and continue to offer alternatives that might be more affordable, particularly if you're not paying for the care of a professional to supervise. And I hope that the federal government continues to invest in research to track outcomes of places that are doing this, and just from a public big picture public health perspective that can show that we can safely decriminalization is the right move, and we can safely move that forward. I think that I know that NIDA put out RFPs recently to actually study how the rollouts of these state systems go, and I think that's going to be really important to get good public health information from the beginning, showing that I think unfortunately for the as long as Schedule 1 remains a barrier, and the state kind of legalization supported adult use systems go forward, the requirement of having a licensed healing center and these really heavily regulated systems with that barrier and no ability to deduct federal income taxes because of Section 280 of the tax code. It's going to create accessibility problems. There's not going to be very, very, very unlikely to be insurance coverage, certainly not anytime soon. And I think that is definitely a concern to the accessibility and affordability component. But I think that most likely still we will see all of these pathways somewhat going forward, at least in certain states, are going to push forward with kind of all of these systems, and there will be kind of working out of the kinks and different amending of bills and things along the ways, and regulations will change as we learn more information. But I think it is likely that we will see some variations of all of this moving forward. And as far as the medical system goes, I think it's just really critical that we're doing good research, collecting good long-term data, and just understanding what are the implications if we're going to be prescribing this and using this as a mental health treatment for specific conditions. We should understand what those implications are, and be working to hopefully get them covered as broadly as possible by insurance, because that it really is going to be critical for people to be able to access moving forward.
Definitely. And despite the fact that there's still plenty of challenges and roadblocks that need to be addressed, I think we're moving in the right direction. I think there's enough people and enough organizations such as Reason for Hope here that are pushing for change and putting in the work here. So I certainly appreciate everything that you've done, Brett. And I want to give people out there an opportunity, anyone that's interested in supporting Reason for Hope, how could they get involved?
Sure. Thanks. Well, we have certainly a lot of activity going on right now, both on the federal legislative front, as well as the state work, and certainly please feel free to reach out to us, info@reason-for-hope.org or info@vmhlc.org for the Veteran Mental Health Leadership Coalition. And we and feel free to visit our websites, reason-for-hope.org and vmhlc.org, and please get in touch, and we welcome as many people as possible to get involved in this work. And really appreciate you having me on, and look forward to continuing to push for some reform at both the federal and state level, and happy to keep in touch. And please feel free to reach out with any other questions.
Absolutely. Well, Brett Waters, it's been a pleasure. Thank you so much. And I look forward to keeping in touch and continuing to follow the progress here of all the fantastic work that Reason for Hope is doing. So thank you again. I appreciate it.
Thank you.